diagnosis of autism has changed tremendously over the last 10, 20 years. And we have started to diagnose children who are less and less impaired and cognitively impaired. And I think that sometimes there are children who are definitely borderline. Those kids that are borderline, very often that would not be diagnosed with autism in 90% of the world, those kids are probably those kids that are either dyspraxic, are clumsy, have problems with copying, have problems with imitation, or are kids who have sensory issues that either are part of the clumsiness or a part of something else. So some of those kids that are borderline might not be your classic diagnosis of autism. It might be some of those kids that have more of the sensory issues that maybe 10 years ago would not have had the diagnosis of autism, and 5 years ago would not have had the diagnosis of autism. Some of the parents are looking for an answer of how to treat, and at this moment in time, there are so many different ways of treating children with autism. And I think that what parents sometimes make the mistake is that to stay with something with the hope that this is going to change their child, because everybody else says it will, okay? And it has worked with everybody else, but it might not work for your child. So they need to look at their child, and if this approach, which might be the best approach in the world, if it is working with your child. And I'm not saying to wait years, okay? I'm saying to wait months.